Welcome to the deep dive. Today we're taking a deep plunge into, well, a really fascinating disease. It affects horses, but it holds this surprising and pretty serious connection to human health, too.
Hmm.
We're talking about equine infectious anemia, EIA. You might know it as swamp fever.
Right.
And here's the kicker, why it's so intriguing. It's caused by a lentivirus from the Retroviridae family, which makes it, believe it or not, a close cousin to HIV-1.
Yeah, the virus that causes AIDS in humans. That connection alone tells you a lot about the scientific weight of this thing, the challenge it presents.
It really does.
Yeah.
So our mission today, let's unpack the essentials of EIA. What is it really? How does it spread, often quite sneakily?
And how do we spot it? How is it diagnosed? And crucially, what does it actually mean if a horse tests positive? For them and for, well, the whole equine community. We're talking horses, donkeys, mules, zebras.
The whole family.
Exactly. And we've drawn from some really solid, detailed sources to bring you this information, tried to distill it down.
Yeah, and it's vital stuff, honestly, whether you work with horses every day or maybe you're just curious about these persistent viruses, how they work, how they impact populations. This deep dive is definitely for you.
We hope so.
We want to give you those aha moments, without drowning you in technical jargon. So let's get into it.
All right.
Okay, so equine infectious anemia, EIA. What exactly is this virus at its core? We mentioned the HIV-1 link, the lentivirus part. Can you paint a clearer picture for us?
Absolutely. So EIA is fundamentally an infectious disease
Oh.
caused by the equine infectious anemia virus, EIAV. And like you said, it's a lentivirus, a type of retrovirus,
Which
which means it's basically built for the long haul. It sets up a persistent, lifelong infection in its host. And yeah, it affects all members of the Equidae family. Horses, donkeys, mules, zebras.
do they all react the same?
Not always. Donkeys and mules, for instance, might actually show less severe signs sometimes. But interestingly, the virus doesn't seem to care about breed or age or sex. No real predilections there.
Okay, that's interesting. Wide range of hosts. But let's dig into the virus itself, because you mentioned something pretty critical earlier. Its genome integrating into the host DNA. That sounds fundamental.
It is. It really is. And this is where it gets scientifically fascinating, but also really challenging from a control perspective. EIAV is an RNA virus.
Mm-hmm.
So when its genetic material gets inside a host cell, it uses an enzyme to make a DNA copy of itself. And then it slots that DNA copy directly into the horse's own DNA.
Wow.
Think of it like
Yeah.
the virus is rewriting a tiny part of the horse's genetic instruction manual to include itself
So it's literally embedding itself.
permanently.
Yeah.
Once a horse is infected, that viral blueprint is there for good. There's no known way to remove it, to eradicate it from the animal. The horse is infected for life.
So it's not just fighting off an invader. The horse's body has actually incorporated the invader, explains why there's no cure.
Exactly.
And you mentioned it has a way of dodging the immune system, like a shapeshifter.
Precisely. That's another key feature. It undergoes what's called antigenic variation, especially in its outer envelope glycoproteins. Those are like the virus's coat.
Okay.
So imagine the virus constantly changing its disguise, its fingerprint, if you will. This lets it keep slipping past the host's immune defenses.
Ah, so the immune system learns to recognize one coat, but then the virus changes it.
You got it. And that leads to those recurrent clinical episodes, those flare-ups we sometimes see. The immune system tries to catch up, but the virus just keeps changing.
That's incredibly clever in a sinister way. No wonder it's so persistent. And does it attack just any cell, or does it have specific targets?
It has favorites. EIAV is known as macrophage tropic. It primarily targets macrophages.
Macrophages. Remind us.
Think of them as the body's vacuum cleaners, or maybe the security guards. They're crucial immune cells, patrolling, cleaning up debris, fighting off pathogens.
Right.
So when EIAV infects these key cells, it disrupts the immune system itself and contributes to widespread tissue damage. It's attacking the defenders.
Okay, so the virus is in there permanently. It's changing its disguise. What kind of damage does this actually cause inside the horse? Which systems take the biggest hit?
Well, once it's established, the virus replicates mainly in those monocytomacrophage lineage cells. Those are the precursors to macrophages, found in places like the liver, spleen, lymph nodes, lungs, bone marrow, even circulating in the blood.
So it's systemic pretty quickly.
Yes. And it also gets into endothelial cells, the cells lining the blood vessels.
Oh, that sounds bad.
It is, because this can create a kind of viral reservoir, a hiding place, and it directly leads to vasculitis.
Inflammation of the blood vessels.
Exactly. And that vasculitis is really central to a lot of the problems EIA causes. It triggers this cascade effect across multiple body systems.
Okay, let's trace that cascade. What are the direct impacts we see in the horse?
You see pretty broad effects.
Yeah.
So in the blood and immune system, the hematolymphatic system, you get anemia, a shortage of red blood cells.
Why does that happen?
Two reasons, really. The virus can directly lead to red blood cell destruction, and it suppresses the bone marrow's ability to make new ones.
Double whammy.
Yeah. And you also very commonly see thrombocytopenia, low platelet count.
Which affects clotting.
Right. Leading to those petechiae, the tiny pinpoint bleeds you might see on the gums, and sometimes more obvious things like nosebleeds, epistaxis.
Okay, what else?
Well, that vasculitis, the blood vessel inflammation, can cause edema swelling, especially under the belly and down the legs. Sometimes internal bleeding, thrombosis. The liver can get involved, becoming enlarged, fatty, even necrotic in spots.
In the kidneys.
Kidneys can take a hit too.
Yeah.
Immune complexes, basically clumps of antibody and virus, can get deposited in the kidneys and cause glomerulonephritis.
Wow. Any other systems?
Occasionally, yes. Because of the vasculitis and immune cells gathering around the central nervous system, you might sometimes see neurologic signs, ataxia, incoordination, stumbling. It's less common, but it happens.
Man, that is a multi-system assault.
Okay.
Okay, so we have a good picture now of what EIA is and the damage it does. Let's shift to how it gets around. How does this virus actually move between horses?
Right. So the main way EIA spreads in nature, the primary route, is through the transfer of infected blood. And the most common culprits are biting insects.
Ah, the flies.
Exactly. Specifically the large ones. Tabanids, so horseflies and deerflies, they act as mechanical vectors.
Meaning they just carry it on their mouth parts. They don't get infected themselves.
Precisely. They feed on an infected horse, get interrupted, maybe swatted away, and then fly to another horse nearby and try to feed again, transferring tiny amounts of infected blood on their contaminated mouth parts.
You can just picture it.
Yeah. And this is why you often see, or historically saw, higher prevalence in areas like the Gulf Coast states in the U.S. The climate there is just perfect for these big biting flies to breed and thrive. Warm, humid.
Fly paradise.
Not very much.
So that's the natural route. But I've heard people talk about human-caused spread, too. How significant is that these days?
It's actually a very significant factor, especially in modern horse management. We call it iatrogenic transmission, basically caused by us.
Okay, like how?
Think about common practices.
Yeah.
Reusing needles or syringes between horses. That's a huge one. If you use a needle on an infected horse, even an inapparent carrier, and then use it on another, bingo.
Right. Obvious risks.
Definitely. Also, contaminated instruments, surgical tools, dental floats, anything that might cause even minor bleeding if not properly cleaned and sterilized between horses.
Dental tools, too. Wow.
Yeah, anything that breaks the mucosal barrier, even things like tattooing equipment, if not sterile.
Yeah.
And another big one is the use of blood products, transfusions using blood or plasma from an untested donor.
So it really highlights how careful people need to be in, like a barn setting or at a clinic.
Absolutely critical. Human practices can unfortunately be very efficient ways to spread EIA if biosecurity isn't tight.
Are there any other ways it can spread? Less common ones, maybe.
Yes, there are a few. Vertical transmission is possible. That's an infected mare passing the virus to her foal in utero before it's born.
Okay.
And the virus has been found in semen and in milk. But transmission through these routes is considered much, much less common or significant compared to biting flies or contaminated equipment.
Got it. So if you boil down the main risks for a horse getting EIA, what are they?
It really comes down to two key things. First, being around other infected horses, especially during warm weather when those big biting flies are active. And second, exposure through contaminated blood, usually via shared needles, instruments, or untested transfusions. Those are the big ones.
Okay. So we understand this sort of silent threat and how it moves, but what does it actually look like when a horse gets sick? Is it always obvious?
That's one of the really tricky parts of EIA. The clinical signs are super variable, highly variable.
Why is that?
It depends a lot on the stage of the disease. Is it acute, chronic, and also on the individual horse's immune system, how it responds. Plus, horses don't necessarily go through all the stages in a neat order. Some might only show mild signs, some severe, some might become carriers right away. It's not a predictable path.
That sounds like it makes diagnosis a real challenge.
It definitely can.
Okay, well, let's break it down. What about the acute stage? If a horse has that initial strong reaction, what are we looking for?
So the acute phase usually hits about 1 to 4 weeks after the horse is first infected. Sometimes it can take longer, maybe up to 3 months. And this stage is associated with really high levels of virus circulating in the blood viremia.
The signs.
You're looking for a pretty sudden onset. High fever is classic, often spiking way up 105, 106 degrees Fahrenheit. That's 40.5 to 41.5 Celsius. The horse will likely seem depressed, lethargic, off its feed.
Okay.
You often see that ventral edema swelling under the belly, down the legs. And because of the drop in platelets, you might see those petechiae, the little red spots on the gums or inside the nostrils. Sometimes nosebleeds, too. Anemia starts to develop, weight loss, muscle weakness, maybe jaundice, a yellowish tinge.
Sounds pretty dramatic. How long does that typically last?
Usually, that really intense phase is less than a week. But, and this is important, sometimes the acute phase can be so mild that the owner barely notices anything wrong. Maybe just seems a little off for a day or two.
Ah, so it could be missed entirely.
Easily. On the other end of the spectrum, though, really severe acute cases can cause rapid breathing, a racing heart rate, or even, sadly, sudden death.
And from a vet's perspective, any lab work clues early on?
Yeah, that low platelet count, the thrombocytopenia, is often the very first abnormality we can detect on blood work, usually right around the time the first fever spikes.
Okay. So if the horse gets through that acute phase, what happens next? Does it just get better?
Not exactly better in the sense of being cured. If it survives the acute illness, it might move into what we call the chronic disease stage.
Chronic, meaning ongoing.
Right.
Yeah.
This stage is characterized by recurrent episodes or flare-ups. The virus starts replicating more actively again, causing repeated bouts of clinical signs.
Like the acute signs coming back?
Similar, yeah. Fever, depression, edema, anemia, weight loss. But the episodes might be less severe than the initial acute phase. And these flare-ups are often triggered by something.
Like what?
Stress is a big one.
Yeah.
Transport, heavy work, maybe another illness like the flu, or even certain medications like corticosteroids. Those can all trigger a flare-up.
So the virus is always there, just waiting for an opportunity.
Pretty much. The classic signs people associate with chronic EIA are that recurrent fever, the ongoing anemia, the persistent ventral edema, and just progressive weight loss. Poor doing.
Does it ever get better? Or do these flare-ups just continue forever?
There is some, let's say, adaptation over time. Usually within about a year of infection, the frequency and severity of these episodes tend to decrease for most horses. Their immune system learns to control the virus to some extent. Not eliminate it, but control the replication better.
Okay, so they learn to manage it, maybe, but are they still infectious during this chronic stage?
Absolutely. And this leads us to perhaps the most critical stage for disease control, the inapparent carrier.
Inapparent, meaning no signs.
Exactly. Many, probably most, infected horses eventually become inapparent carriers. They look completely healthy, no fever, no edema, good weight. You'd never know by looking at them.
But they still have the virus.
They absolutely do. They are seropositive, meaning they have antibodies in their blood, which tests can detect, but they show zero clinical signs. And, crucially, they remain infected for life and are a lifelong reservoir of the virus.
So they can still spread it, even looking perfectly healthy.
Yes. That's the real danger. These inapparent carriers are fully capable of transmitting EIAV to other uninfected horses via biting flies or contaminated needles. They are the silent spreaders that make control so difficult. You could even do a necropsy, a post-mortem exam, on an inapparent carrier and often find nothing obviously wrong.
That's a huge challenge for anyone trying to manage horses. So summing up the physical exam, if a vet is looking at a horse, the findings could be anything from totally normal to
really sick.
Yeah.
Exactly. You might see a horse in poor body condition, lethargic, running a fever with those petechiae on the gums, ventral edema, pale mucous membranes from anemia, maybe a nosebleed, maybe even ataxia. It just depends entirely on where that horse is in the disease process, acute, chronic, or inapparent.
Right. So with such variable signs and these silent carriers out there, how on earth do we actually detect this virus reliably? What are the tools in the diagnostic toolbox?
Well, the cornerstone of EIA diagnosis is detecting the horse's immune response to the virus. Specifically, we look for antibodies against EIAV in the blood serum.
Antibodies.
And this is a really key point. Because it's a lifelong infection, once a horse develops these antibodies and tests positive, it will remain positive for the rest of its life. There's no clearing the virus, so the antibodies persist.
Got it. So once positive, always positive.
Correct.
So obviously, if a horse has those suspicious signs, recurring fevers, anemia, weight loss, swelling, maybe a known exposure, a vet should be thinking about EIA. but the definitive diagnosis comes from these antibody tests.
Yes, and the most famous one, the one most horse people have heard of, is the Coggins test.
Right, the Coggins, that's considered the gold standard.
It is. Technically, it's called the AGID test, which stands for agar gel immunodiffusion. The Coggins test is named after Dr. Leroy Coggins, who developed it. It's a clever test, really elegant in its simplicity.
How does it actually work? What's happening in that little test well?
Okay, imagine a small dish filled with a special agar gel. In the center, we put a tiny amount of EIAV antigen, basically, purified parts of the virus. Then, in wells surrounding the center, we put samples of the horse's serum. Now, if the horse's serum contains antibodies against EIAV, those antibodies will diffuse out through the gel, moving towards the antigen in the center. The antigen is also diffusing outwards. Where the specific antibody and antigen meet in the gel, they bind together.
And you can see that.
Yes, they form a visible line, a faint white line of precipitation in the gel between the wells. That line means positive. Antibody met antigen.
That's neat, like a little meeting confirmation.
Exactly. It's highly specific, meaning it rarely gives a false positive, and it's considered about 95% accurate overall. It usually detects antibodies reliably within about 45 days of the initial infection. But the results take a little time, usually 24 to 48 hours, sometimes longer, for that line to form clearly.
Okay, the trusty Coggins. What about the ELISA test? I hear that mentioned a lot too, seems faster.
Yes, the ELISA enzyme-linked immunosorbent assay is another very common blood test for EIA antibodies. It has some advantages. It's generally more sensitive than the Coggins, meaning it can sometimes detect antibodies a bit earlier, maybe within 10 to 14 days after infection in some cases.
And faster results.
Much faster, yeah.
Yeah.
Often you can get ELISA results back within a few hours.
Mm-hmm.
Big advantage for, say, pre-purchase exams or urgent movement. However, and this is really, really important,
Okay.
the ELISA test is less specific than the Coggins. It has a higher tendency to produce false positive results.
Ah, so it might say a horse is positive when it actually isn't.
Correct, it happens. Therefore, and this is the crucial regulatory and diagnostic point, any positive result on an ELISA test must be confirmed with an AGI test, the Coggins test. The Coggins is the official tiebreaker, the confirmation test. You don't take action based solely on a positive ELISA.
That is a vital distinction for owners to understand. Don't panic on an initial positive ELISA, wait for the Coggins confirmation.
Absolutely critical.
So besides Coggins and ELISA, are there other lab findings that might point towards EIA, even if they're not the definitive diagnostic test?
Sure. While the antibody tests are the regulatory standard, other things on routine blood work can certainly raise a vet's suspicion. We already mentioned thrombocytopenia, that low platelet count is often the very first flag in an acute case, along with the fever.
Right.
Later, you'll typically see the anemia develop. So, decreases in packed cell volume, PCV, or red blood cell count. You might see changes in white blood cell numbers, sometimes elevated liver enzymes. There are other tests, too, like PCR, which looks for the virus's actual genetic material, its RNA or DNA.
Is PCR used much?
It can be useful in specific situations, like testing foals born to positive mares to see if the foal itself is infected, or just carrying maternal antibodies. But it's not the routine screening test. Regulatory agencies rely on the antibody tests, and PCR can sometimes give false negative if the amount of virus in the blood is very low, like in an inapparent carrier.
Okay, makes sense. So with EIA being the serious lifelong disease, what does this all mean legally and for the horse industry? Are there regulations around testing?
Oh, absolutely. EIA is a reportable disease in the U.S. and many other countries.
Meaning?
Meaning if a laboratory gets a confirmed positive test, a positive Coggins, or an ELISA confirmed by Coggins, they are legally required to report that result to state and federal animal health officials.
Okay, that's serious.
It is. And beyond reporting, testing is legally mandated for many common activities. You typically need proof of a recent negative Coggins test, or an approved ELISA that's been confirmed negative if initially run for things like moving horses across state lines or entering Canada or Mexico.
And for shows and sales?
Yes, usually required for entry into public exhibitions, shows, races, sales, often required just to board at a new stable or go to a breeding farm. And the testing has to be done by an accredited veterinarian, and the samples run at a USDA-approved laboratory. It's all about tracking and preventing spread through controlled movement.
That heavy focus on testing and control makes perfect sense, given everything we've discussed about how EIA works. Which brings us to the really tough question. What happens if a horse does get that confirmed positive Coggins test? Is there any treatment? Is there a cure?
This is the part no one wants to hear, but it's the reality of EIA. There is no effective treatment that eliminates the virus. There is no cure.
None at all.
None. Once infected, that horse is infected for life. And adding to that challenge, there is currently no commercially available vaccine that's approved in the United States or Europe that reliably prevents a horse from getting infected in the first place.
No vaccine either. I thought I heard something about one in China.
There is a modified live vaccine that has been developed and used in China, but it's not approved or available here, and there are complexities with using live vaccines for retroviruses, including potential safety issues and interference with diagnostic testing. So for practical purposes, in most of the world, there's no preventative vaccine.
Wow. And are there any treatments that should absolutely be avoided?
Yes, one critical point, corticosteroids. Drugs like dexamethasone or prednisolone, they are strongly contraindicated
Why is that?
because they suppress the immune system. And in an EIA-positive horse, giving steroids will likely cause the virus to replicate much more actively, worsening the viremia and potentially triggering a severe clinical flare-up. So definitely avoid steroids.
Okay, no cure, no vaccine, avoid steroids. That's a bleak picture. So if treatment isn't an option, what are the options for managing a horse that tests positive?
Given that the horse is a lifelong reservoir and poses a risk to other horses, the most commonly recommended course of action in many areas, particularly in the U.S., is euthanasia.
That's tough, but it's primarily to protect the wider horse population.
Exactly. It's considered the most effective way to remove a source of infection and prevent further spread. However, euthanasia isn't always mandatory everywhere, and some owners may choose not to. In that case, the only other option is lifelong, strict quarantine.
Lifelong quarantine, what does that actually involve? It sounds intense.
It is incredibly strict, and it's a legal requirement with oversight from state authorities. The positive horse must be kept permanently isolated from all other equids, horses, donkeys, mules.
How far apart?
The standard requirement is a minimum distance of 200 yards. That's about 183 meters at all times.
Why 200 yards specifically?
That distance is based on studies of how far those large biting flies typically travel between feedings. It's considered sufficient to minimize the risk of mechanical transmission by flies.
Okay. What else does quarantine entail?
Rigorous, intensive fly control is absolutely essential. Using effective fly sprays, fly sheets on the horse, meticulous stable hygiene, removing manure, frequently using fly traps, managing standing water where flies might breed, anything to reduce the vector population around that horse.
And no interaction with other horses?
None. The quarantined horse cannot go to shows, trail rides, anywhere off the property. It can't be housed where it could have fence line contact or share airspace in a barn with negative horses. It needs permanent identification, often a specific brand like a letter A or a freeze brand number, or a lip tattoo indicating its positive status. And the owner bears the full legal responsibility and cost for maintaining these conditions perfectly for the horse's entire life.
That sounds like an immense commitment and responsibility.
It truly is. Very challenging logistically and emotionally. In some limited cases, positive horses might be allowed to go to approved research facilities, again, under very strict biosecurity, to be studied.
Okay. So euthanasia or extremely strict lifetime quarantine. What about just making the horse feel better if it is having clinical signs, one of those flare-ups? Is there supportive care you can offer?
Yes, absolutely. Supportive care can be given to help alleviate the symptoms during a clinical episode, but it's crucial to remember, this care does not treat the underlying infection. It doesn't eliminate the virus or change the horse's positive status.
Right, just managing symptoms, like what?
It might involve things like intravenous fluids if the horse is dehydrated from fever and not drinking. Blood transfusions can be given for severe life-threatening anemia, but that's really just temporary relief and has its own risks. Good nutritional support is important. Anti-inflammatory drugs like flunixin, meglumin, Banamine can help reduce fever and aches. Simple things like cold hosing the legs or sponging the horse down can help manage a really high fever. Standing leg wraps might provide some support for severe ventral edema. It's all about comfort care, symptom management.
Got it. So given the lack of cure and the difficulty of quarantine, it seems blindingly obvious that prevention is where all the focus has to be.
Absolutely. Prevention isn't just the best strategy, it's basically the only effective strategy we have against EIA.
So what are the absolute key pillars of prevention that every horse owner needs to know and practice?
Okay, number one, routine testing. Get your horses tested regularly. Annually is the general recommendation, but maybe more often if they travel frequently, go to shows, or are exposed to new horses regularly. Know the status of your own animals.
Makes sense. Test, test, test. What's next?
Number two, Quarantine and test new arrivals. Anytime a new horse comes onto your property, isolate it from your existing horses for a period, say, 30 to 60 days, and get it tested for EIA, if it doesn't already have a very recent negative test. Don't let it mingle until you know it's negative.
Good biosecurity practice in general.
Exactly. Which leads to number 3, strict biosecurity and daily management. This is about those day-to-day actions.
Like the needles we talked about.
Absolutely top of the list. Never, ever reuse needles or syringes between horses. One needle, one syringe, one horse, period. Dispose of them properly.
What else falls under biosecurity?
Thoroughly clean and, ideally, sterilize any instruments that might contact blood or mucous membranes between horses. Think dental tools, surgical equipment, even tattoo needles or microchip implanters. Implement a really comprehensive fly control program, especially during peak fly season. Use repellents, traps, fly sheets, manage manure properly, eliminate standing water, make your property less inviting to those big biting flies.
So test regularly, quarantine new horses, and practice really strict hygiene and fly control.
That's the core of it. And maybe number 4 is just awareness and education. Owners need to understand the disease, understand the risks, and understand why these preventative measures are so important. It's a community effort.
Right.
Everyone doing their part protects everyone.
It sounds like a lot of individual responsibility, but has this overall strategy actually worked? Has it made a difference in controlling EIA?
Oh, yes. A huge difference. Since the Coggins test became widely available and federal and state control programs were implemented in the U.S. back in the 1970s, focusing on that test and remove or quarantine strategy, the prevalence of EIA has dropped dramatically.
Really?
Dramatically. It used to be much more common. Now, positive cases are relatively rare in most parts of the country, often linked to specific exposure events or areas where testing might be less consistent. It's actually considered a major success story in veterinary public health, showing what coordinated testing, surveillance, and biosecurity can achieve.
That's genuinely encouraging. It shows these efforts, even if demanding, really do pay off.
They absolutely do.
Okay, so just to recap everything we've covered, equine infectious anemia, EIA, is this serious lifelong viral infection. No cure, no effective vaccine readily available, which makes rigorous testing, the Coggins test primarily, and really diligent prevention, the absolute cornerstones for protecting not just individual horses, but the whole equine community.
Precisely. Understanding EIA isn't just about dodging a bullet for your own horse.
Yeah.
It's fundamentally about responsible horsemanship. It's about recognizing that your actions impact the health and well-being of other people's horses, too. It's about contributing to that collective safety net, being part of the solution, not the problem.
That's a great way to put it. And it leaves us with something to think about, doesn't it? It's quite striking that even with all the progress we've made controlling diseases like EIA through testing and biosecurity, that lingering threat of the asymptomatic carrier, the horse that looks perfectly healthy but is silently spreading the virus, really underscores how vigilance is just constantly required from everyone.
Continuous vigilance.
It makes you wonder, especially now with the horses potentially moving around more, globally even, beyond just following the rules, what more could individual horse owners do? What's that next level of proactive guardianship look like to really safeguard against these kinds of silent, persistent threats in our interconnected world? Something to mull over.